Hello, good afternoon from the East Coast or morning. No, I guess it's afternoon in the morning as well. We're gonna give it about one more minute to let folks come on in, and then we'll get started here.
Joe, I think you're on mute.
Sorry about that. So I was just introducing you, Emily, but good afternoon, everybody. Joe Racalto, I'm Policy Director at NMAC. Glad to have everybody here on this very important town hall on the president's budget as it relates, more specifically as it relates to CDC grants. I'm really honored to have Emily Schreiber here. For those that don't know Emily, she is the Senior Director of Policy and Legislative Affairs for NASTAD. Emily, thanks for joining us. We wanted to kind of dive right into this because we know that there is a lot of confusion, a lot of chaos that's going on in regards to the CDC grants. And I'm wondering if you could start us off and tell us what you know. And I've got a lot of questions. And I will say for participants, if you do have a question, go ahead and throw it into the chat. We will get to them, or we'll try to get to them, but we do have a lot of questions, Emily, that hopefully you can be some kind of an answer for us.
All right. Thank you, Joe, and thank you all so much for having me. I'm really pleased to be able to join today. I do wish it was on a slightly more uplifting topic, but happy to be a resource for people. So as Joe said, I work at NASTAD. NASTAD represents the chief public health officials who work on HIV and hepatitis programs. So that is typically your AIDS director or your HIV program director in states and some cities and the territories. And so today I'm going to talk a little bit about what is happening with the grants for HIV prevention for health departments, as well as some other things that have happened. So currently, we are in the fiscal year of FY 2025. And while that fiscal year started in October, Congress didn't actually decide the amount of funding that should go out until March. But that actually is okay because usually the health department fiscal year begins in June. So that means that the funding starts on June 1st. And it will go and last an entire year. So on June 1st, health departments were supposed to receive year 2 of their cooperative agreement 240047. This is funding directly from CDC for health departments, and it is the flagship health department grant. That means that it covers all almost all HIV prevention activities that health departments do, including ending the HIV epidemic activities, testing, surveillance, partner services, education campaigns. So sort of almost all the funding that funds through health departments comes from 240047 grants. That includes funding that they subgrant to community-based organizations. Unfortunately, it is June 9th, and that funding has not been released yet by CDC. So NASTAD has been working with our members and working with CDC to try to get this funding released as quickly as possible. The CDC, I think, is doing what they can, and our members are working on contingency plans to try to keep funding flowing, but they have no incoming funding, and there are sort of mixed answers on if they can use expanded authority. So some jurisdictions have had to send out stop work orders. We are hoping that those are as temporary as possible, and others have been able to do some braiding of funding, but even that braiding is not going to last forever. So that is sort of what is happening with the 240047 grants.
Thanks, Emily. And I do have some questions I want to ask you. Can you explain for us or to us what is the cause of the delay in releasing year 2, given that the funding has already been appropriated for FY 2025?
That is a great question, Joe. And I think it's very important to know that this funding has been appropriated, as you said. So we have not heard anything official, but we are hearing that the Department of Health and Human Services has instituted a significant new clearance system that looks over every single notice of award that goes out from CDC and other parts of HHS. And that has significantly slowed the process. So instead of, before, like the Division of HIV Prevention would approve this, perhaps the center, there might be some FYIs. Now it is going up to the HHS level to approve grants.
Mhm. Thanks, Emily. And what immediate steps, I guess, are health departments taken to ensure the continuity, the continuation, I guess, of
Yeah.
services when they have no funding coming in from these grants?
So I think that health departments are doing everything that they can in places where there is state funding. I know that the jurisdictions there are using their state funding. In places where there isn't state funding, some health departments have gone to ask for an emergency request from their state budgets to help get through this. Others are trying to, use different funding streams. Some already have it set up, so their CBO grants don't start until July 1st. So they are able to sort of try to shift internal people at the health department onto other grants temporarily and not have their CBO grants affected yet. These are all temporary measures though, and they cannot last forever. So it is important that these funds are released sooner rather than later.
And on that point, is there an estimated timeline or process benchmark for when year 2 funds will be released?
Unfortunately, we don't have an updated timeline. I was certainly hoping that they would be released by now, but we are really pushing as hard as we can. NASTAD has, and with the support of our partners like NMAC, have been talking about this on Hill visits and asking for Hill visits or asking for congressional members to weigh in with Congress or weigh in with HHS about the expedition of these funds.
And then, Emily, has Congress received any formal explanation from CDC or HHS about the delay in obligating the CDC 24047 grant or funds?
So far, we have not received a formal response.
Okay. And can appropriators, I guess, looking ahead, can appropriators include language in like this year, the FY26 spending bill to prevent any such delays or require like a minimum obligation timeline for critical public health grants? Is
I
that
think that's a great question, Joe. In theory, when a Congress appropriates funding, constitutionally, the administration is supposed to implement that funding. And so we have seen lawsuits around apportionment. This doesn't qualify as apportionment yet because there hasn't been an official notice that things will be there hasn't been an official notice of delay or cancellation, and that helps us give us standing. I saw in the chat that somebody had asked about the legal thing, ways forward. So I just wanted to make sure we address that. So I think right now, so in theory, Congress shouldn't even have to put in something like this because the administration should just be able to implement their funding as they are legally obligated to do. If this continues to happen, and we have seen sort of creative ways to, I guess I'd say creative ways of apportionment and the impoundment of funding, we could potentially push Congress to put in legislation.
to enforce? Yeah, but who would enforce it, right?
Right.
Emily, what data, if any, is being collected on the scope and impact of program pauses? For example, reduction in testing, PrEP linkage, community outreach, et cetera.
So NASTAD is collecting data. So we have had impact statements that our jurisdictional health departments have sent in, but also if you are hearing about things happening in your state, please email me. I see in the chat, Katja and Stephen talked about what's happening in Houston and in LA. So we are collecting this. We are sharing it with our congressional partners to really show the impacts of how this is already impacting things. And we're 9 days into the fiscal year.
And is there a centralized effort to track and publicize the health consequences of this funding disruption across jurisdictions?
Yes. So we have sort of a two-pronged approach right now. So we're working with our members to get these immediate impact statements that we will be, working with Congress on. And then we also have a longer sort of more detailed survey for them that we will be publishing data from as well.
Okay, that's good to
The
know.
impact statements and I say this as well for our community partners, informality is fine. We really just want to know the impacts, whether that's a sentence or 3 paragraphs. It's really more important that we just have some idea of the impact. And I will also put my email in the chat. So if people want to email me things, they absolutely can.
Great. Thanks, Emily. And are you aware of any other programs at CDC that have been impacted by funding delays such as this or RIFs?
Sure. So at CDC, there have been a variety of things that have been put on hold recently. So, and a lot of that is due to the reductions in force. So the reductions in force started on April 1st or April 2nd. And this was when the HHS announced the elimination of many job positions, particularly at CDC's Division of HIV Prevention. And through those reductions in force, we saw an elimination of 5 program branches. So since then, because there's nobody working in those program branches, there's nobody who is legally able to oversee some grants, which means that they have already told certain grants that they will end at the end of their fiscal year, which is actually FY24 money. They won't even get FY25 money because there's not somebody to oversee that. So that includes the REACH grant, which is focused on rural outreach to people through community health workers. And there was 4 health departments that received that, as well as the grant that focused on looking at why people are diagnosed early and why people are diagnosed late and kind of comparing that. That also went to 4 health departments. In addition, the medical monitoring project was supposed to start on June 1st, but it did have to have a new application and competition. No application and competition has been released, and obviously there has been no funding released as a result of that. So that is another grant that has effectively ended.
And go ahead, Emily.
Oh, sorry, go ahead.
Well, along those lines, I was wondering, were these grantees given any opportunity to propose like continuity plans, continuity, you know what I'm trying to say. I can't tongue-tied on a Monday, or like alternative monitoring strategies before the termination decision was made?
As far as I know, there was no offering of that. I do know so the Together Take Me Home project, which is a national project focused on at-home testing, I think that they've been trying to pursue different paths of appeals, but we'll see how successful those are.
Then what happens, Emily, to participants currently enrolled in these now defunded programs? How are they, how are their care and preventive services being managed or transitioned?
Sure. So luckily well, for Together Take Me Home, I think if we were to see the elimination of that, we would see a large elimination of at-home testing programs, which would be really horrible. And then for REACH, that means that we'll probably see a decrease in rural outreach. And so people who may have been touched for HIV testing in more rural areas will not be able to access it through this program. And then so that is really a detriment. And especially because the 240047 funding hasn't gone out, there's no sort of safety net. If a health department who had received REACH or received some of these other grants was able to have their full funding right now, they might be able to be like, oh, okay, we need to shift a little bit of funding to this rural outreach. But because there is no funding, they can't do that right now.
So flipping to another one, Emily, given the documented like outcomes of the TTMH program, including cost savings and new diagnosis, what justification, I guess you could say, has CDC provided for not continuing those projects?
So those projects is simply because they legally cannot continue them because there's nobody to legally oversee them. So that is illegal. Like CDC has to have somebody who can oversee these grants. And so because of the reductions in force, there is no one there. So this is not necessarily a CDC decision on staffing. It was, I think, at the HHS level. And so those reductions in force did impact the services being able to provide.
Okay.
They're able to provide.
Two more questions for me, Emily, and I really appreciate you kind of, rapid fire through these. I guess overall, what does the president's budget request say about HIV prevention? Like how will this impact the future of HIV funding? And thirdly, I guess, what message are we using with Congress?
Great. Thanks, Joe. So yes, this is all about FY 2025 funding, which we had already resolved in Congress, and should be smooth sailing. So when we think about appropriations, the president releases a budget request, and it is merely a request. It does not have the power of law, but it does talk about the priorities of the president. And that has come out a little bit piecemeal, but we have learned more about the president's budget request in the past week or so. And the president requested that they shift the EHE funding, which is about $220 million, to the new Administration for Healthy America. And then the rest of the HIV prevention funding, they propose to eliminate. So that means that there would be no surveillance, no HIV prevention in places that don't get EHE funding. It would greatly impact testing. It would greatly impact access to PrEP. Now, again, this is a request. The power of the purse actually lays within Congress. So Congress right now is working on their versions of the budget, of their appropriations bills. So the House will make one and the Senate will make one. So the House markup is going to be at the end of this month. The Senate will be a little after that. And so as Bill said in the chat, this is not passed through Congress. We still have a lot of time to influence this, and we are working on that to try to get to the highest possible levels. So they are both trying to complete their bills by August. We'll see what happens. This Congress has been a little bit chaotic and hasn't met a lot of deadlines. But they do need to come to agreement by September 30th, or they'll pass a continuing resolution. A continuing resolution essentially means you're going to continue the funding levels from the previous fiscal year for a set amount of time. That can be 2 weeks, that can be 2 months, or it can be the full fiscal year. So we ended up in a continuing resolution for the full fiscal year for FY 2025.
Would that go back? Go ahead, Emily.
Oh, sorry. So we are still waiting to see what happens there. We're doing a ton of advocacy. I know in the chat, Bill McCall talked about Save HIV and the ABAC group. So ABAC is the AIDS Budget and Appropriations Coalition, which is a subgroup of the Federal AIDS Policy Partnership. I know many of you participate on that, but again, if you're interested in learning more, you can email me. My email is in the chat. I'm one of the co-chairs of that. And then the Save HIV funding group does a lot of helping people get meetings with their members of Congress at home, also does a ton of great social media work and media work on why it's so important to save HIV funding.
Great. And then just one more final question, I guess, in the chat. And thank you, Jeremiah, for putting in the website for Save HIV funding. By the way, at USCHA, this year it's in Washington. I do want to do a plug here. We will be doing a rally. We will be doing a reception after the rally, and we will be doing a Hill Day on the eve of USCHA. So there will be more information on that to come. I guess Kevin, Emily, Kevin just wanted to know, do we have any sense for the outcomes of the markups?
That's a good question, Kevin. Now, I'm not a betting woman because I'm quite unlucky in a casino, but if I was going to make predictions, I would say that the House will probably follow the president's budget, and the Senate is currently operating under the idea that they're going to do a bipartisan bill. The Senate will require 60 senators to pass a bill, so they need to make it appealing to Republicans and Democrats. So I think that we'll see much more protection of funding in the Senate bill. Yeah,
thanks for that question, Kevin. I think those are all the questions we've had. Again, these town halls are meant to be, 20, 30 minutes, just telling the community what we know. Emily, I really want to thank you for taking the time to kind of go through all these questions. I know that NASTAD is on top of it, and whatever we can do to help you, we are here. And to everybody else, we thank you for attending. We will be doing another town hall on the riders. And then once we know more on the outcome of the markups, we will be doing a town hall on that. And just a reminder to contact the Senate, because we're still tracking the Medicaid component on reconciliation. So Emily, thank you. I appreciate it, folks. Thank you. We have over 300 here, so appreciate your participation, Emily.
Thanks, everyone.
Bye-bye now.